Welcome, everyone. My name is Dr. Beth Brooks, and I'm the clinical advisor here at Vivian Health. Each month, I put out a video about recruitment and retention tips called On the Horizon in Healthcare. So today, I'd like to talk about the 12-hour shift. And for those of you who haven't been nurses for a terribly long time, the 12-hour shift was not always a way that we staffed nursing units. Back in 1989 was the first time the 12-hour shift was used as an attempt to staff nursing units, in particular critical care units, during a nursing shortage. And the idea was that it was to be an experiment or a pilot, and that we didn't know what the impact of the 12-hour shift would be on nurses or on patients. But then before we knew it, the 12-hour shift was being used throughout the organization. So today I want to talk about what do we know about 12-hour shifts? What's the cumulative effect of fatigue? Does that impact nurses? How does that impact patients? And so I'd like to share some of those research findings and offer some suggestions. So let me take you back to 2004 when the American Nurses Association put out a position statement about appropriate nurse staffing. And one of the beliefs or tenets of appropriate nurse staffing is that there should be the right types of nurses for the right types of patients in the right setting, clinical area. And as time went on, there was a very famous report that came out in 2004 from the Institute of Medicine about keeping patients safe. And in that report, the whole effort was around keeping patients safe, reducing medication errors, reducing falls. And one of the recommendations made in that report is that nurses should work no more than 3 consecutive 12-hour shifts. No nurse should work more than 60 hours in a 7-day pay period, and that shifts should not be longer than 12 and a half hours. And so this was also very new finding at the time, but something that hospitals were beginning to think we need to move towards this more safe staffing model. Also at the same time in the IOM report was strongly encouraged that hospitals limit the amount of voluntary overtime. And voluntary overtime, as we all know, happens when someone might call in sick or there's someone who's unable to make their shift. And then we try to ask our colleagues to come and volunteer to take on an extra shift. Well, I suppose that occasionally happening is not necessarily something to be worried about. But if that becomes a habit of this voluntary overtime, it does build fatigue for nurses. And sort of as a result of too much voluntary overtime, some states have now even legislated a limit on the amount of involuntary overtime. So if your employer demands or requires that you do overtime by the Fair Labor Standards Act, that is in fact allowed. However, 19 states now have prohibited the use of mandatory overtime because we know that accumulation of fatigue is not good for nurses and it's not safe and good for our patients. So here, time has gone on. We've begun to see this accumulation of evidence about the impact of fatigue on nurses and on patients. And then in 2014, another report came out from American Nurses Association indicating that it is a joint responsibility between an employer and a nurse to be working together to properly staff a nursing unit, and that it's an ethical responsibility for the employer and the nurse to do the best that they can do to make sure that that unit is safely staffed. And over time, again, more and more evidence, more studies have been done about nurses and fatigue. And here's some of the things we now know. Number one, rotating shifts is really difficult because it disrupts your circadian rhythm. Anything that disrupts your circadian rhythm impacts how you sleep. Shift work is also needs to be limited, the number of consecutive shifts work. The more shifts you work in a row, the more fatigued you become. We know also that fatigue can lead to medication errors. It can lead to situations of needle stick injuries, inability to stay awake at work, nurses dozing off at work. It affects your short-term memory, and especially the amount of sleep you receive in the 24 hours before your shift very much impacts how alert you are during your upcoming work shift. And we even have some studies about younger nurses who enjoy the 12-hour shifts, feeling more pressure, more stress, less able to handle an emergency situation because of the fatigue and the less emotional resilience they have compared to maybe more experienced nurses who only work an 8-hour shift and are better able to handle those more stressful situations. We also know that nurses have motor vehicle accidents on their drive home from work. There's been nurses who've been in multiple car accidents. And unfortunately, we've even had reports of nurses who have died after falling asleep at the wheel on a drive home from work. So this is nothing to be made light of. Fatigue is a serious issue in our nurses. It's particularly a challenge after coming out of COVID and the pandemic these last few years. And so anything we can do to decrease that fatigue. And actually, too, there was another study that talked about any shift over 8.5 hours or over 10.5 hours, medication errors go up. And so it's probably time for us to take a good hard look at what we're doing with 12-hour shifts. And is that the best way and the safest way to be staffing our units? National Institutes of Occupational Health and Safety have a tremendous amount of resources for you if you're interested. They have policies and procedures. They have webinars. They have different checklists and different toolkit that you can use in your organization, and perhaps distributing some of those webinars to your staff. We've also have had some recent studies. One of the approaches has been, well, just ask the nurse if she's tired. If she's tired, she shouldn't come to work. Well, as it turns out, nurses are not terribly good at assessing their fatigue level. And in fact, in 2 studies that were published at the end of 2021, nurses were very not able to identify how fatigued they were. So it's probably time to think about, is there another way that nurses can assess their fatigue and their fitness to duty? And in fact, there is a tool used in the airline industry and in the nuclear power industry about fitness to duty. And it's been called for a number of times that this measurement tool should be used also with nurses, but it's not something that has caught on in the nursing profession. So again, a strategy that you might want to think about looking at in your organization. The other simple thing is to have policies and procedures that are really clear about the number of consecutive shifts worked, the number of overtime worked, PTO time that you take in a year, the number of time between shifts that one is off. So there is a lot of strategies that are fairly straightforward and fairly simple that your organization might consider implementing. The other opportunity or the other resources available is Healthy Nation, Healthy Nurse from the American Nurses Association, which again has a toolkit, an app, and an assessment for nurses to help understand what is their level of fatigue, how is their sleep, and fatigue accumulating, and you're adding stress to that fatigue. And so there are some ways to help our nurses have less fatigue, have less severe accidents at work, and also keep our patients safe. And the final word of caution, I guess, I'd like to share is that there's this super nurse syndrome that many of us have heard about, where nurses don't want to call in sick or have to take one and go in for the team. And there's particular units where the culture might be every nurse comes in when they're needed, and even if it's your day off. And that is something to be really careful about, because some nurses, it actually has a name. It's called coerced voluntary overtime. So too, think about how you monitor extra overtime and that culture on some of the units where that sort of behavior is encouraged. So I want to thank you for joining me today to learn a little bit more about 12-hour shifts and the impact on nurses and on patients. And if you have any questions or comments or would like to learn more, please reach out to us at hire.vivian.com. And thank you.